Good afternoon. Most of you have heard so many people talking today. I hope you'll give us just a little bit more of your attention because we're going to wrap this up with some ideas for future education and training. So I was asked to talk a little bit about public health education and training. A little bit of background about me. I've been working in this area for 3 decades, and for the last 10 years I've been working in academia, the last 6.5 years in an accredited school of public health, and I serve on the education board for the American Public Health Association. So in preparation for this, I reached out to my colleagues on the education board and beyond, so I'm going to bring you some ideas, some things that are happening elsewhere in the country. First, the Council on Education for Public Health. They're the accrediting body for public health schools and programs, and currently there are 51 schools, 102 programs, and 30 applicants. That means they're working their way through that accreditation process. Just in a single year, the most recent data that they provided to us, they graduated over 10,000 students. Now recognize there are many programs that are out there that are very large that are not accredited, like Walden University. They enroll more public health students than just about any of these programs. 6,700 of those that have been in accredited programs that graduated with a Master of Public Health degree. So that's considered a professional degree. 20 schools and 8 programs have undergraduate programs. And in fact, this is one of the fastest growing majors in the country. So a lot of interest in this. And in fact, this fall, just this past month, CEF came up with procedures for accreditation for those programs. So in addition to CEF, the accrediting body, there's the Association of Schools and Programs of Public Health, and they came up with a core competency model. Within that is a section that pertains precisely to health literacy. Under diversity and culture, they said a new graduate with an MPH can not only explain why cultural competence alone cannot address health disparity, but also differentiate among these terms: linguistic competence, cultural competency, and health literacy in public health practice. Now fast forward, go to the new examination that's out there, the Certified in Public Health exam. Take a look at the study guide that's available from the same institution, the Association of Schools and Programs in Public Health, and they don't include any definitions for health literacy. They do include definitions for linguistic competence, cultural competence, and cultural and linguistic competence, but not health literacy. So obviously there's a disconnect in the implementation. So something precise that we can do something about. All right, so I said, okay, I'm going to reach out to some other schools, find out what they're doing. Well, I'm a graduate of Johns Hopkins. I got my master's degree and my PhD there. So I said, okay, let me see what Johns Hopkins, most people will consider that's one of the, leading schools of public health out there. Well, embedded in their MPH competencies is a section called social and behavioral competencies. None of this says anything about health literacy, but it talks about communication. It says that these students, when they graduate with an MPH from Johns Hopkins, should be able to come up with strategies for improving the health of communities and individuals for preventing disease and injury, and they specifically mention communication. Now, they have required courses, and students are required to take one of 2 Introduction to Public Health type courses. One is the Tools of Public Health Practice and Decision Making and Problem Solving in Public Health. So I reached out to those individuals who are responsible for teaching those classes. I said, do you cover health literacy at all? And what they told me is there are no assigned readings and that it's essentially embedded in the discussions in regards to communication. They also have an elective health literacy course. Now, I'm not saying that this is just a picture of Johns Hopkins. I would say this is probably a very similar picture across the country. I even talked to a site visitor for the accreditation process, somebody who's been serving on the board for about 6 years for CEF, and he said that basically they don't look to see under that diversity and culture whether people are really covering the concept of health literacy in the education to the MPH students. He said that's getting into the weeds. Okay? So I'm just letting you know, all right? Now, undergraduate public health education, this is really a hot spot, okay? Because we're going to have a lot more undergraduates that we can influence. So CEF's new guidelines for accreditation for the undergraduate programs has a section on skills, domains, cross-curricular concepts, and diversity. All of those pertain to health literacy. For instance, under skills, ability to communicate public health information to diverse audiences, okay? So it doesn't say health literacy, but you can see how it could be operationalized under there. So what have some schools done? CEEF has some examples about the competencies for the various schools. Temple University is one of them. Now, obviously, they developed these competencies for undergraduates before this brand new set of competencies came out from CEEF, because they essentially adopted the one for Master of Public Health students. But in their template, they say that this differentiate among linguistic competence, cultural competency, and health literacy and public health practice is covered in numerous courses. Look how many courses touch on that within the undergraduate program. So, okay, that's what's happening in the schools. Are the schools meeting the needs of the workforce? Now, in addition to accreditation for the schools and programs of public health, we also have an accreditation process that's been around just for about a couple years for public health agencies, local and state health departments. So how are we doing? Now, I would love to take this map and overlay it with Andrew's map, okay? This would be interesting, right? Because this might be the place that we can really influence in regards to teaching these concepts. Those that are in yellow, sort of that greenish yellow, those are states with accredited health departments. Those are in blue are states with health departments that are in the process of getting accreditation. The reason why I'm saying this is a place we can influence is because in the criteria for accreditation of public health agencies, there are several standards that pertain to this. For instance, 3.1, provide health education and health promotion policies to support prevention and wellness. Under there, they particularly mention health literacy, that health literacy should be taken into account. Standard 3.2, provide information on public health issues. Variety of methods, variety of audiences. And they say materials that are culturally appropriate at low reading levels. Standard 7.2, identify strategies and implement them to improve access to healthcare services. Again, they mention literacy. Standard 11.1 is where training fits in when they talk about operational infrastructure. So here's a place we can do something about. Now, there is an entity that tries to do this crosswalk between academia, okay, how we're training people in the schools and programs, into what the workforce needs are. And that's the Council on Linkages between Academia and Public Health Practice. There are over 18 organizations that participate in this dialogue. And so here are the core competencies for public health professionals that I pulled out that I thought were relevant in terms of health literacy. What's interesting is they're separating out communication skills from cultural competency. But what's under cultural competency also pertains to health literacy. For Tier 1, those who are just coming in entry level, to identify health literacy of population served. For Tier 2, those who are program managers, supervisors, that they assess the health literacy of population served. Tier 3, senior managers and executives, those ensure that the population that's served, that their health literacy is considered throughout all communication strategies, okay? Under cultural competency, here are the strategies again. Incorporate strategies for interacting with persons from diverse backgrounds, and they include, in addition to socioeconomic status, they also include education. So how are we doing in terms of providing this training to people who are already out there practicing? Well, there's a lot of emphasis in the Affordable Care Act for community health workers, and so I thought this was a nice example that I got from colleagues through the Latino Caucus of the American Public Health Association, and we had Latina that provided the information. This same training they also provide to medical students. You notice that they have to do the math here, numerous of these competencies, 8 core competencies that they're covering. And they have communication skills where health literacy is specifically mentioned. But also in that box are the class standards. Now, class standards are typically considered something that we cover in cultural competency, and this is one of the important points that I would like to make. If you are looking for health literacy education and training, you have to look under the rock of cultural competency, look under the rock of health equity training, look under the rock of health disparities, because it could be covered under those. And instead of perhaps putting a lot of energy into coming up with a new mandate for this training, instead work with the people who are already working in these areas and see if you can embrace health literacy into that. What I find interesting is cultural competency essentially in 2 places, communication skills and interpersonal skills. Health literacy essentially could do the same. So what other continuing education is out there? Well, Kiko, who's one of the members of the Education Board, works for the New York City Health Department. She shared this information. They had got outside funding for 3 years to conduct trainings. They ended up training 800 staff, both in basic and advanced levels in regards to health literacy. The purpose of these trainings was so that they could provide more effective communication of healthcare information with adults who are functionally illiterate. This is quote unquote. I just had to share that language with you. And they covered things such as easy writing, language issues, and communication issues, but you see, they married cultural competency in this training. Now, I asked her about evaluation. I said, did you evaluate it? She said, well, we did the typical evaluation, whether they liked the training, whether they felt they got something out of it, et cetera, but they really didn't do a long-term impact to see whether it changed their behavior and practice. She said, unfortunately, after 3 years of funding, this training has ended. So they haven't been able to continue this, but it might be a model to take a look at. So I would argue there's a need for curricular integration and evaluation of new integrated curriculum because there is commonality between cultural competency and health literacy training needs. We have a common goal of disparities reduction. We have a common communication skill set. Both aim for improving the quality of care that's provided. Our curricular time is limited. People don't want to add more to what already is being demanded. And so we've got to do a better job of sort of being more efficient with our time there. That curricular integration mimics actual practice. And so we felt that designing core learning outcomes and competencies for both is a start. So those of you who are members of the Roundtable will have already gotten the set as one of your handouts of an effort that we had funded by the National Institute of Minority Health and Health Disparities. Bonnie Braun, who was originally the director of the Center for Health Literacy at my school, the University of Maryland School of Public Health, we were having one of those hallway conversations. She said, what do you do? And I said, well, I'm doing cultural competency. Well, what is that? And so I was explaining, and we were talking. It's like, boy, there's a lot of commonality. So we got funding from NIH to bring in experts from cultural competency, health literacy, health disparities to talk together about what those commonalities are, what those commonalities were in terms of research needs, in terms of the tools that we can use. We came up with a primer working together with Department of Health and Mental Hygiene with contribution from these experts to identify those core competencies and find related resources. An example resource is the Health Resource and Service Administration's training that combines both cultural competency and health literacy. This is an online training. So examples of common research questions. What are best practices in health literacy and cultural competency training? What are effective teaching methods? We don't know the best ways to teach. What faculty development is necessary? We're finding from faculty who are given this responsibility, they don't feel prepared to give this training. How can we include community stakeholders for health professional training? So we were talking about action-based research. We should also consider those same concepts in our education and training. And to summarize, as I've talked about so far today, there are many players involved in public health education and health literacy. The requirements for public health programs and schools are not in sync with workforce needs, and health literacy education is variable in those programs and schools. And education in cultural competency or communication or equity or health disparities may cover aspects of health literacy. And I would finally like to close. At the American Public Health Association annual meeting this year, I walked around to all the exhibit booths, and I looked to see what the textbooks were available on health disparities, cultural competency, health literacy, etc. Looked in the index. Not a single health disparities textbook mentioned in their health literacy. Not one single health disparities textbook mentioned health literacy. I found that mind-boggling, okay? So it's like we've got to talk together. We've got to stop with the separate silos. And I'm eager and very pleased that I was invited to be able to talk to you about this today. So thank you very much.
Thank you.